Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning.
Good morning, everybody.
We
Good
have
morning,
a crowd here. We're
everybody.
going to need bleachers
Everybody,
soon.
good morning.
Good morning.
We're going to need bleachers soon, right?
Good morning, Sherry.
Good morning, Dr. Mencia.
I'm doing great.
It's
I'm
always good to see you
Good
with
to
that
s-
smile.
Thank you.
So now we have a lot of people. I'm just going to
Zoom around.
Right. Okay.
In
So
the live feed.
right, we're going to tag.
Inuchka,
Right.
kakanuchka on the side.
Yeah, we're going to. There's someone else there. Who's there?
Oh, come in.
Oh, no. That's for next. That's the next one. Let me just do this. Hello. Okay, we're just gonna. This is a. We're actually. Let's keep talking because this
Yes,
Facebook
yes.
Live
Good
is
morning,
just something
Anita.
extra, right? So, Dr. Mencia, you're very big into home care, as we know that most physicians don't do that, and so you were kind enough to ask a very nice group of people to come here.
Yes, they are from Atlantic Home Care. And, it's a very interesting company because the owner herself is a healthcare provider. She's a physician assistant,
Physician
right?
assistant.
Physician assistant, right? And she went into the field of home care. So it's interesting when you have somebody like that know what the services entail and the quality of service. What is that all about?
It's not just a companion going in
It's
there.
not just a companion going in, right? So she, I know her personally, and she's always on top of her staff, to make sure that they provide the service not only according to the law, but that the service is top of the line. So it's a great company to work with, and since we've been doing the home visit, what a better company to pair up with. To be able to work together. So, sometimes we go to the home. Like this week, I had a patient that he's demented, and he has 2 kids. Now, they both marry and have their own family. And daddy want to stay home. So how is he going to remember to take his medication for the memory? And one of the daughters that came with daddy said, but he's declining. This medication is not working. Mm-hmm. So I said, well, how do you know that he's taking it? She said, I don't know. I see a bunch of bottles. So I said, okay, bring all the bottles over. So she came the next day. And they were a bottle of medication for Alzheimer, months and months and months that were sitting there.
Expired.
I said, okay, we need a nurse to come in. We need somebody to check his blood pressure. Mm-hmm. He was declining. So I said, we're going to need physical therapy to get him back on his feet. And when you talk to him, he say, I don't want to go to a nursing home. Right. I don't want to go to an ALF. I'm comfortable at home. And dementia is, you have stages. So he's still at the stage that he can make certain decisions. And, a good home healthcare company become crucial for those services that the patient needs.
And so I'm going to then ask our guests, of course, who are here, is Sherry Harris and Robin Faircloth. Are you a good home health agency like Dr.? Of course, you can start first, and then we're going to have you comment.
Well, it's an interesting question because I come from the skilled nursing background, and
Right.
most people would prefer to go home. So I'm going to touch on Dr. Mencia's comment about people staying at home. They don't want to go to a skilled nursing. They don't want to go to an assisted living facility. So when an individual goes home, it's so crucial that there's medication management. So somebody is checking to make sure they're not doubling up on their medications. Physical therapy, occupational therapy. So Atlantic Home Care provides the Medicare home health, so what a patient can avoid going to the skilled nursing facility or to the assisted living facility. Mm-hmm. So what happens from hospital to home is we are able to send a nurse, usually within 24 hours, And we're actually able to provide that 7 days a week, even on a Sunday if we know in advance, which is unusual.
Right.
And if the individual, such as this gentleman with the dementia, needs a further level of assistance, Atlantic Home Care has a different niche because we can provide, including with your services, a nurse practitioner based on the criteria if they need further eyes on that patient. Why we don't want that patient to go back to the hospital. So that nurse practitioner can come within 24 to 48 hours, oversee the care even more, go through the medications, make sure that they're on board with all the medications, speak with the physician, and if that individual does not have a primary care physician, unlike you, Dr. Mencia, who you're always available for your patients, we can then provide a mobile physician such as you to go to the home, make sure that patient has eyes on that patient, even a higher level. And we want to reduce that risk to go back to the hospital.
So, Robin, I know that you've been very big into the whole world of Broward Health. So,
Yes.
so why don't you explain what it is that makes your company different?
I was listening to Sherry intently and then Dr. Mencia, and being part of Broward Health, working in the hospital systems. I also worked in the Memorial. I've worked for HCA hospitals.
So you started when you were 3.
I started when I was 2. And I'm acutely aware, and I choose that word properly, of the needs of the providers, and then to notice the needs of the community. And I've now been in home care for 15 plus years, and I love it. People say, oh my gosh, home care. But I see the difference. I see the families that their parents, they're all over the nation, they're international, and they have family here and parents. They need advocates. They need somebody to speak on their behalf. But most importantly, they need a resource that has the community relationships, and you have the go-to. So when we say we provide a care transition flow, I'm actually working very closely on the steering committee for the Broward Coalition for Health Services Advisory Group, which has a 5-year contract with CMS to partner with community resources to help these patients do and get to their independent level as much as possible. And working with a home visit physician group like Dr. Mencia, to me, every pilot I've worked in every health system has been critical to have that resource. Now, these patients have community doctors, but they can't get to them.
Right.
So, Dr. Mencia, we're doing this Facebook Live and already have people who are calling in, writing, good morning. So, Dr. Mencia, but I do have to say that, it's funny. I'm so used to just talking and not having this up. I'm going to have something better than this. I'll have to have my own person I bring in to show your beautiful face. But let's just get on this. So the whole point, Dr. Mencia, is you started, how many years ago? Was it 3 or 4 that you decided I'm going to go into people's homes? Remember?
Well, no, it was really 20 years ago when I opened my practice. The dream was from the get-go to provide the full spectrum of geriatric care. That was the dream. And within 3 years, I was able to open the geriatric center. Within 3 years of being in the community, I was able to open the geriatric center. And from that point, I used to spend a little bit of my time doing home visit, but I would be very limited. I couldn't travel, let's say, to Miami and see a patient or West Palm Beach and see a patient. As long as it was within the vicinity of the office, I would go and do home visit. So I did pick up a lot of patients 20 years ago from A1A on Broward and what have you. And then I started getting some private patients, some high-end patients that wanted to have a private doctor, and they would pay privately to get access to directly to me 24/7. And I started doing that. But taking care of the patient at home became more and more of a passion when I started then getting nurse practitioner and other doctor to join me. And then I was able to expand Tri-County now and be able to do the service Tri-County, where some of the nurse practitioners that live in Miami, they go and see the patient around there and the doctors there. Some of the ones that live in Broward do the same thing, and West Palm Beach, they do the same thing. So we have been able to expand Tri-County, and I try to provide the service. I try not to go places that will be too far, because those patients need care. You know, you cannot cover the whole sun with one finger. So they need care, so we try as much as we can, the area that we can. And we have been able to expand over the past 20 years. So home visit is part of the training that we get in geriatric medicine. As a matter of fact, when I did my fellowship, I did a 2-year fellowship in geriatrics. So I am trained as a hospice physician. I am trained as a geriatrician for home care, for palliative care. And sometimes I have to be on with my staff, with my nurse practitioner, because sometimes the patients, they are not ready to call hospice, but they don't want to go to the hospital. And my nurse practitioner, they will call me and say, oh, this patient has an enlarged heart and is not breathing well and refuse to go to the hospital and refuses hospice. I say, okay, that's the rights of the patient. So take care of the patient with what the patient wishes are. And as long as the patient and the family understand that we'll do our best and the home is not the hospital, so we do our best at home. But sometimes when we provide the service and it's not provided by a geriatrician, you get people that come into the home and they try to make a hospital out of your home. And that's horrible, because that's not what I want in my house if I need services. I don't want you to make a hospital out of my home. I want to live at home.
I understand.
Yeah.
But Dr. Mencia, I think it's a good time for me to give everyone your phone number, because there are so many people out there who are in this condition at home and they don't know that they can have people come and help them. So let's just do that. Phone number for Dr. Mencia's institute is AGI Medical and Dental Centers, and they're both in Fort Lauderdale and Boynton Beach, and the phone number is 954-489-1345. Again, it's 954-489-1345. So all you need to do is call there, and then they will arrange to have home visits for them. But it takes a little. Someone has to make an appointment. You have to get the pencil in your hand. Remember, this is Pencil Talk Radio. You must do something so that the wonderful ladies who you've brought here this morning from Atlantic Home Care can really have that opportunity to go. Right, I've got it. Mm-hmm. Isn't that right?
Exactly.
Because
there are a lot of Medicare home health agencies out there. One of the reasons why I decided to go with Atlantic Home Care was because the owner has a vision, and because she's a physician's assistant, she's very clinically based. Most Medicare home health agencies, we're all in it, we're in a business, but sometimes don't understand the clinical part of it as far as the top leadership. So the owner and CEO has that clinical background. So she has her finger on the pulse of every need out there with every individual. And to stay home is such a blessing, because I see how people feel when they go to a skilled nursing facility, or then they have to leave and go to an assisted living facility. So you may have individuals also dealing with behavior. They could be depressed. Their life is changing. We're also able to provide behavior nurses, somebody that can come in as a social worker, somebody that can come in, talk to them about their needs emotionally. It's not just taking care of them clinically, but they also have needs emotionally, along with the family who are facing a different need to support their loved ones.
And that is so important, because, sometimes they can end up in a psychiatric hospital.
Exactly.
Because they are so poorly attended when it comes to their behavioral issues or emotions. It could be depression, anxiety, agitation. And I'll give you an example. Sherry, I had a patient that the daughter, and this is a person from an extended family. So it's not like the person is there by herself, just kids and grandkids and in-law, extended family. Sometimes they come and they fill my room with just the family and the patient. And they wanted to take her to the psych hospital because she was too jittery and agitated.
Right.
And knowing the patient now for over 8 years, I said, well, that's not my patient. She's never been like that. So I said, do me a favor. Before you go to the ER, bring the patient by, bring me all the medication,
Medications.
everything, put it in a shopping bag and just come over. And they came over. The patient do have dementia. She had been put on 3 medications for dementia. And they tried one, and that didn't work. So they tried another one, that didn't work. So they tried one that was a combination. It's 2 in 1. She was taking all 3 of them. And she was taking all 3 of them. I say, just let's right away with this. She shouldn't be taking this garbage. You know, she already know that and she's there. And she say, oh yeah, that one is no good. so we left her on one medication, and she went home. She come for a follow. We send the visiting nurse to follow up with her, and nobody in the family, despite an extended family, nobody in the family have knowledge of medicine. So they didn't know, what was going on, and they were getting ready to put this lady in a psych hospital. And God forbid, what would have happened then? You come with 3 or 4 psychiatric medication now.
And now you're
plus being
crossing
labeled something else that you don't really have.
You already have that. So that's where our medication management will come in to make sure those medications don't cross. The behavior nurses can come in, make sure the medications are nursing, our transitional care team, our nurse practitioner. And that's where we're going to keep your community back from being admitted back to the hospital and a change in their
So I want to ask Shelley something. Robin. I want to ask Robin something. Robin, so, you have a great responsibility as an executive in this, in the Atlantic Home Care. It's very big responsibility for you to get the right people to be there. And that's unfortunate. Sometimes there's a shortage, and I've dealt with home health agencies, and people they send are really not what they should be doing. So tell me how you deal with that.
Well, we partner in the community. We don't have nurse practitioners that work for Atlantic Home Care or physicians. I wish we could have Dr. Mencia on staff, so we'll talk. But it's the partnership in the community, and then we have Medicare has certain guidelines and rules of participation. And so if you understand that and you follow that and you train your staff upon that, some home care agencies do not provide skilled care, wound care. They don't provide IV nurses. We do. And so there's a certain education level that you have to follow in training and protocols and algorithms, clinical pathways that are established and proven to help your cardiac patients, your wound care patients, and then you reach out to the community and you you identify when we're doing the home assessment in the hospital bedside. Wow, this patient doesn't have a primary care doctor. Dr. Mencia would do fabulous with this patient. Let's send in a nurse, start the assessment, ask the patient if they would like Dr. Mencia's team to come in, and then we communicate, and then we follow that for 30 days and track and trend it. Then we turn around and communicate to the hospitals, this is what this team did, and this was the outcomes for that team. So finding the right staff, they have to up their game to be a part of that.
Dr. Mencia, this is so important to hear this because this is what you dream of. This is the finish of your dream team, isn't it?
Absolutely, yeah. It's bringing all the pieces together, different company, but working in harmony, which we have been doing for years. We just need more harmony so that at the end result is to provide the best care possible for those patients. And with what Robin was saying, when it comes to the transition, even if the patient has a primary care doctor, you do not have to lose your primary care doctor. We can come in for the first 30 days as a physician or nurse practitioner and the home visiting nurse. our part is to come in for the first 30 days or 2 weeks. Whenever you feel strong enough to go and see your primary care doctor, we back away. So the objective is that if you ended up in the hospital with congestive heart failure and they give you new medication, now you have the old medication at home and you don't know what to do with your loved one. We will come in and say, okay, these two medications are the same. This is a more powerful one, so you don't need this one anymore. We will arrange the medication. That is the number one concern when you leave the hospital. A lot of my patients, when they are able to come to the office, they say, see your primary care hospital provider within 3 days. Right. You might not be strong enough to go to the primary care within 3 days. So a lot of times you opt for going back to the emergency room, and that's the wrong thing to do. What you need to do is right away, if you call and say, I need home visit, Medicare will cover a doctor, our company. Even if we are not your primary, they will cover our company to come in within that period of time to prevent a readmission to the hospital. And what we do during that time, review the medication, look at the environment, bring Robin to come with the staff and say, okay, we're going to put the physical therapy, occupational therapy, speech therapy, psych nurse, wound care nurse, whatever you need, we're going to put that there for you until you are strong enough to go for outpatient wound care or go back to your primary. It's that transitional period that people tend to neglect and become the crucial time. That's why Medicare opted for paying anybody that will come to the home, because they will be saving money by doing that versus readmitting the patient back to intensive care. It's thousands of dollars.
Right, and think about the poor patient. I mean, this is a lovely thing that you all do. So I want to give the phone number again. Remember, get your pencils out. This is the most important number you're ever going to write down in your whole life. Okay, it's 954-489-1345. We won't give the Boynton at a phone number. Just let them call there, and if you want to get it in Boynton. But the most important thing is that this program this morning has certainly served a great purpose to make people understand that whether you've just come back from the hospital or you're not feeling well and you can't get out of your home, you need to get attention. Otherwise, people say, I don't want to go to the hospital because I could die there. You could die in your home, too.
And, one other thing with the patient I have worked with Atlantic Home Care is that they receive their brochure, they receive a booklet with all the information pertinent to their condition. If it's congestive heart failure, hypertension, diabetes, they will empower you so that you can sit at home and start reading on your condition so you can better yourself. And not only that, once Medicare say, okay, that's enough, we don't need Atlantic Home Care anymore, they stay in touch with you, which is great. A lot, and that's the difference. We have over 1,000 home health, over 1,000 home health care agency just in Broward County only. That we say like over 1,000. When you read the number, you say this is crazy. Some of them are owned by business people, and some of them by nurses and PA and healthcare providers. And those that are owned by healthcare providers, they understand the law of Medicare, where the one owned by business people, their bottom line is the money. How much money am I going to make? So if the person needs occupational therapy, but it's going to cost me too much money to put the occupational therapy, I'm not making a profit, so I'm not going to do it. And that's the beauty of working with companies like Atlantic Home Care, that they understand, of course, they have a bottom line that they want to meet, but they also understand the need of the patient, and that's very important.
That's very much like you.
Also,
we have 1 minute. Whatever you're going to say, you're going to do it in 1 minute.
Medicare provides this free of charge to the patient, so there's no out-of-pocket for the patient to have home health, skilled nursing, physical therapy, occupational therapy in the home, because it's provided under Medicare until Medicare and the physician and the individual feel it's no longer required.
Well, we have Gary Polk is watching and Lawrence Lambert's watching. We're on
Thank
Facebook
you.
Live, everyone, and we want to thank everybody. That the half hour goes so quickly with Dr. Mencia.
Valentine, give me the
Valentine. Okay.
give me the camera. Valentine is coming up, so Stonewater will have a lot of special coming up. So we'll probably bring Christian by so we can talk about all the special.
Okay. Phone number for Stonewater is 954-561-8799.
I'm going to take myself there for Valentine.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.